Hello and welcome to this video about Status from Star Storage. Status is designed to take the interaction between patients and the healthcare industry, including doctors, healthcare providers and insurance companies, to the next level. Now doctors and patients can quickly access a unified electronic record containing patient history and medical profile, can store and organize data from various sources including mobile devices, and can unleash the full potential of collaboration to improve the quality and efficiency of medical services. Status empowers doctors and patients to communicate in a secure online environment. Medical services suppliers thus have access to a professional platform to engage with their patients, to promote medical personnel, and to attract more customers by providing modern and personalized healthcare services that will transform transitory patients to loyal customers. Status as a service means no capital investment, information stored on dedicated servers in secure data centers with worm and fully encrypted storage, with all access via a secure data line. Status is a modern healthcare solution that addresses real-world challenges. Collaborative healthcare. Status is redefining the way healthcare providers work, collaborate on medical records, and connect with their patients. Secured healthcare. Status is a safe and secure location for storing medical data with excellent capabilities for long-term medical information storage, including retention, digital shredding, and so on. Digital healthcare, enabling zero paper healthcare. Status is designed to help healthcare businesses to be successful in a changing digital world, to treat more patients, get reimbursed faster, and stay ahead of change. Connected healthcare with IoT or Internet of Things. With Status, patients are able to retrieve lab results and medical images, view records and prescription history from a growing list of health applications, imaging and lab devices, and pharmacy apps. Patient engagement and community integration, enabling zero-distance healthcare with virtual health assistants, second opinion services provided through voice and video conferencing. Mobile healthcare. With Status, the services are available at any time on any device. Cloud-delivered healthcare. Status fully leverages powerful cloud-based technologies but can be just as easily installed on-premise, offering the same world-class services built to scale on your desktop, tablet and smartphone. Let's look at some of the main features of Status. I'll begin by logging in as a patient. Notice that connections to Status are secure and encrypted, a username and password is of course required, and patients are able to self-register, allowing them to get started quickly and easily without the practice being involved. By default, on login, patients land on the Health Summary page. Here they can find general information about their medical history, family history, allergies and other information that might affect their current or future health. Patients can easily add information. Here the patient has recently suffered from a case of bronchitis. Let's add that. The patient can decide who gets to see their medical information. They can share it with the doctors they're registered with, and they can also choose to share the information with all doctors and medical staff in the Status system in case of an emergency. Emergency information can be reviewed in the Emergency Information pane. The patient's medical record is at the heart of the Status system. Here all documents and medical reports, including X-rays, CT scans, photos and video recordings and so on, are uploaded, accessed and reviewed. Patients can edit information and change the access rights of documents that they've uploaded. Documents and information uploaded by a doctor can only be reviewed and downloaded by the patient. If the patient or their loved ones receives a serious medical diagnosis, they might want a second opinion before seeking medical treatment. Medical data can be securely shared with non-Status users with medical collections. Sharing includes a view-only option so that no download of the information is possible and no data moves out of Status. Status allows the patient to select multiple records and use them to create a collection of documents for sharing with other Status users, or even with users outside of Status based on their email address. A collection can always be edited later, including who the information is shared with, their access rights, and what documents are included in the collection. For health and lifestyle tracking, Status maintains a list of important medical parameters and their associated values so that their evolution over time can be reviewed by patients and doctors. Choosing any parameter provides a historical graphical view of the parameter. Patients can even define and track specific sets of related parameters, known as health sets, for example to monitor a chronic condition. Patients also have the option to monitor their health using a daily health journal that allows key medical parameters to be recorded on a daily basis. These recordings can be shared with doctors. To provide the best quality medical services and treatment efficiency, Status includes its own prescription and medication management module. The web application works in sync with the Status mobile app. The mobile app alerts patients when their medication is due and allows them to record the fact that they've taken the medication. In this way, the patient's treatment compliance can be tracked. Patients and doctors can view the medication history, current prescriptions, make changes to it, and add new medication. Patients can schedule their medication times based on the doctor's recommendations. Based on this calendar, patients get notifications in their mobile app. Let's look at some more of the features of Status. Each patient can easily access a list of doctors that they're connected to. Multiple filters by name, location, speciality, age, and so on make it quick to find a doctor with whom the patient wants to open a conversation, make an appointment, or cancel the connection through which the doctor previously had access to shared medical information. The general public can also check doctor and medical staff information, which can include professional experience, their schedule and location, assistance and feedback from patients. When patients have been treated by a doctor, they can leave feedback, which needs to be approved by the doctor or healthcare provider in order to become visible to everyone else. Through virtual medical services, that is voice and video services, Status makes the concept of zero-distance healthcare a reality. The patient can quickly see the list of available doctors for audio-video interaction and can initiate the call with a simple click. During the call, the medical file can be instantly accessed and updated based on the information exchanged during the conversation. The appointments page provides a quick view of existing and future appointments and also allows patients to arrange a new appointment. Click on the Add button and find a suitable doctor. Select one of the doctor's free time slots and the appointment is made. The consultation history section allows a patient to review previous consultations, the type of consultation, whether it was an audio, video or physical consultation, whether or not the consultation actually took place or was cancelled, and details of the date and time of that consultation. Status has been enhanced to allow patients and doctors to monitor COVID-19 related symptoms and other information that might be relevant to a suspected case of coronavirus, including travel information, possible exposure, and contact with suspected or confirmed sufferers. It also allows patients to enter and track daily readings for COVID-19 related symptoms so that patients and doctors can keep their eye on their symptoms both in suspected and confirmed cases. If the patient has a contract with a health insurance company, they can immediately access a centralized view of their active insurance policies. Clicking on the Details button displays exhaustive information on benefits, limitations, insurance conditions, and shows downloadable documents such as policy documents or procedures for accessing medical services. The My Benefits area shows a wide range of related services and promotions from service providers, thus providing additional value for the user. Status comes with its own built-in messaging system, available both online and through the mobile Status app. Users can communicate with ease, they are notified when new messages arrive, have a history of all conversations, and can easily check the profile information of whom they are talking to. Finally, Status has a system for generating automatic notifications based on system events or administrator settings. Notifications can be configured to be received online, via email, or delivered to mobile devices. This concludes our presentation of the core functionality to which patients have access. Next, we'll discuss the functionality which is available to doctors. As with all Status users, doctors access the application using their username and password. Access to different areas of the application is based on roles attributed to each user. By default, the application is set to take doctors to their consultation dashboard. Here they can view the patients that are waiting for them in the surgery and quickly access their medical file. They can also see upcoming appointments and patients waiting for a consultation and the length of time since they arrived at the clinic. Doctors can view and edit their profile and add any information they consider relevant to their professional experience. They can also edit their schedule and add an out of office. They can view and approve feedback comments from patients. They can see their appointment history and patient visits. For ease of use, Status allows doctors to create treatment schemas. Adding a treatment schema to a patient's medication automatically inserts the new medication with its timetable and dosage to the patient's existing treatment. Treatment schemas can also be made public and shared between doctors. Finally, let's see the doctor's view of a patient's medical file. Not all doctors can view a patient's medical file. Only those who are connected to the patient can access all information. Other doctors can only view emergency information. A doctor is connected to a patient either manually by the reception desk or automatically the first time his patient is confirmed to have arrived for a visit. You might notice that the medical record has a number of different records when viewed as a doctor. This is because of security and access rules that control the level of access for every user in the system. These are just some of the core features of Status. The application offers many other features, such as a reception desk dashboard through which you can control, schedule and manage patient visits and appointments, a management area offering reports on staff performance and business efficiency, and a user-friendly interface to allow administrators to manage many of the application's default settings. If you'd like to learn more about Status, please visit us at www.status-online.com. This concludes our short presentation. I hope you found it useful. Status: better healthcare, better life.